So what can you tell me about your patient, Talia?
He had oral surgery for tongue cancer, so he has a gastrostomy tube for supplemental feeding.
To help him consume sufficient nutrition.
Right. It's also very difficult for him to swallow his medication because of mouth ulcerations related to chemotherapy. So we're using the gastrostomy tube for medications as well.
Then you'll use liquid medications whenever possible. Now, why do you think this is?
They're readily absorbed and less likely to cause tube occlusions.
Right. Now, certain solid dosage medications can be crushed and combined with liquid. These medications should be crushed to a fine powder and mixed with 15 to 30 milliliters of water before delivery through the tube. But before you do this, be sure to consult your drug administration guide because not all medications can be crushed.
I remember reading that. If a tablet has a special delayed release coating, it cannot be crushed.
Excellent, Talia.
How about capsules? Can you open those and use them?
Yes, certain capsules can be emptied into liquid and administered through the tube, but you should always check manufacturer recommendations and verify with a pharmacist first. You can also find this information in your drug administration guide or check with the pharmacy.
Okay.
Now, do you have all the equipment you need?
Yes. I have the irrigation set in the room. I also brought a waterproof pad to help keep the patient and bedding dry, and gloves to put on when I administer the medication. Now I'm going to perform hand hygiene.
Okay. Okay, so what do we need to know before we administer the medications?
I need to know the medication's actions, any special nursing considerations, the safe dose ranges,
Purpose of administration.
right, and any adverse effects of the medications.
Consider the appropriateness of the medication for this patient too, and always make use of the 3 checks and the rights of medication administration, including asking the patient about allergies. So what's first?
Okay, so I enter the passcode into the computer and select the proper patient. Then I read the medication administration record, the MAR, and select the correct medication from the patient's drawer, which is the first check. Guaifenesin, 400 milligrams, seems appropriate to help with the patient's cough.
Correct. That's check 1. Next, compare the label with the MAR, which is the second check. Check expiration dates and perform any calculations necessary.
Okay, guaifenesin, 400 milligrams. The dose ordered is 400 milligrams. The package is labeled 400 milligrams per 10 milliliters. So let's see. I need 10 milliliters to make the correct dose.
Right, very good. And since the guaifenesin is a liquid, you'll need to check the label to see if it needs to be shaken.
The label says to shake before opening. Okay.
What else?
Next medication. Read the MAR and select the medication from the unit stock, lisinopril, 10 milligrams. Lisinopril, 10 milligrams. This is the first check. Again, it makes sense to be administering as he has hypertension.
Good thinking.
Then compare the label with the MAR, which is the second check, and check expiration dates.
Is there anything you would want to know about your patient before administering this medication?
Yes, since it's prescribed to treat his hypertension to lower it, I should be aware of the patient's blood pressure before administering. I just obtained a blood pressure measurement. His blood pressure is 132/78, so it's okay to administer, right?
Yes, that's correct, because the order says to hold for a systolic blood pressure less than 100 or a diastolic blood pressure less than 60.
Oh, Ms. Thomas, this is a tablet.
Well, what modification should we make for a tablet since we're administering via a gastrostomy tube?
I can check to see if it can be crushed safely, right?
Right. Let's look in our medication reference to see if it can be crushed.
It can be crushed and mixed with water, which would be appropriate for putting through the tube, right?
Correct. So grab the pill crusher. Remove the tablet from the package. Place the tablet in the crusher and crush it.
tablet is ground. Now I dissolve in water, right?
Yes, pour the powder into a plastic medication cup and dissolve in a small amount of water. Then keep the medication wrapper with the dissolved tablet so we can recheck the medication before we give it to the patient. Any additional meds for now?
That's it for this time period.
Okay. Now, depending on facility policy, you may perform the third check of the medication labels with the MAR now, before taking them to the patient. However, we'll do the third check at the bedside after confirming the patient's identification based on this facility's policy.
Okay. So I sign out of the medication supply unit before we go and bring the bedside computer, right?
Right. And when you transport the medications to the patient's bedside, be sure to do it carefully and keep the medications in sight at all times.
Okay.
But first, we have to clean the pill crusher.